Hello. March 30th is World Bipolar Day. So let us see some of the famous personalities who have bipolar disorder. We have Winston Churchill, Catherine Zeta-Jones, and Kurt Cobain, and many others. So who actually suffered from the disorder and who have fought with it. Let us try to remove some of the myths associated with the disorder. Let us create some awareness. Bipolar disorder is actually a mood disorder and it is a medical illness. There was this person who was living in a hotel for almost like a year. He had grandiose ideas about himself that he's equal to the king and he liked people coming and serving him. He liked that royal kind of a life. So though he had a family, he had a lot of marital conflicts. So he came out of the house and he was spending lakhs of rupees, and almost more than a year he was staying in a hotel. So this person was actually suffering from an episode of mania. So in a manic episode, we have a person whose mood is like extremely elevated, extremely happy, elated. They have racing thoughts. The thoughts come one after another without any break. And though they sleep for only 3 or 4 hours, the energy levels are always up. So that is what happens during an episode of mania. And in bipolar disorders, we have alternating episodes of mania and depression. Studies also suggest that people with bipolar disorder are prone to self harm more, almost like 50 times more than the general population. Also, the substance abuse, that is resorting to drugs or alcohol, is more during a manic episode, and even sexual advances are more. That is, the high risk taking behavior would be there during a manic episode. Sometimes it's very difficult to identify a hypomanic episode. So manic episodes, there is impairment in functionality, but hypomanic, as the word suggests, the manic episode is not up to that severity, but there is like high energy levels, increased productivity. We can see in a few people like at higher positions who perform very well, who might be requiring less amount of sleep, so they could be suffering from a hypomanic episode. Causes for bipolar disorder are actually multifactorial, but there are definite genetic causes. That is, there is a genetic relation for bipolar disorders. So if one of the parent is having a bipolar disorder, the child is at a risk of 10 to 15% of getting this disorder. Since the episodes could be triggered by some major life events, any stressors associated in life can trigger any manic or a depressive episode. So if you notice in yourself or in your friends any of these symptoms, lot of mood fluctuations, lot of irritable behavior, it's always best to get a screening done whether it falls under a bipolar disorder spectrum from a professional, because early the identification, the better would be the prognosis of the problem. So the first line management of bipolar disorder would definitely be medications. After that, along with the medications, we also do psychotherapy sessions. Many people have this stigma related with psychiatric medications, but because it is a medical illness, unless and until the biological changes that are happening are balanced with the medications, things are not going to be stable, and the quality of life would be damaged if we delay the treatment. Please share it with your friends and let us all try to lead happy lives amidst all the mood fluctuations.